All right, let's talk about something that affects millions of people, but is, surrounded by a ton of confusion. We're talking about the right way to treat genital herpes. There's so much noise out there, so in this explainer, we're going to cut right through it and give you a clear, evidence-based answer straight from the official medical guidelines. So let me ask you something right off the bat. When it comes to genital blisters, is the treatment you're thinking of, or maybe even the one you're using, actually the right one? The answer might really surprise you, and honestly, it's crucial for getting any kind of effective relief. Okay, so first things first, before we can even talk about the right treatment, we've got to understand what we're actually dealing with. Let's take a quick look at what causes this super common condition. To put it simply, genital herpes is a viral infection. It's caused by one of two types of the herpes simplex virus. You've got HSV1 and HSV2. The main thing that sends people to the doctor is an outbreak of these painful blisters or sores. And that right there, the fact that it's a virus, is the absolute key to understanding how to treat it. All right, so this brings us right to the heart of all the confusion, the big cream versus pill debate. I mean, it just makes sense, right? You have a problem on your skin, you put a cream on it. That feels intuitive, logical. But what does the scientific evidence actually have to say about that? Let's break it down. So here are our two main options. On one side, you have oral antiviral pills. You take them by mouth, they work throughout your whole system. On the other side, you have topical antiviral creams. You apply them directly to the skin for a more localized effect. Now, one of these is the standard, recommended by all the guidelines, and the other, well, it's a really, really common misconception. So let's move away from what seems logical and get into what the experts have actually concluded after looking at all the data. We're going to go straight to the source, the official treatment guidelines from the CDC, the Centers for Disease Control and Prevention. And boom, here it is, the knockout punch. The CDC guidelines state that topical antiviral creams offer, and I'm quoting here, minimal clinical benefit and is discouraged. I mean, it doesn't get much clearer than that, does it? It's a direct, unambiguous recommendation against using these creams for genital herpes. So, why are they so against it? Well, the science is pretty straightforward. The cream just doesn't get into the genital skin very well, and because of that, it doesn't really speed up healing in any meaningful way, and it doesn't reduce the amount of virus being shed. So you'd be applying this stuff 4, 5, 6 times a day for basically no benefit. Okay, so we've officially busted the myth about the topical creams. So now let's put all our focus on the path that is backed up by solid evidence and recommended in every major medical guideline. This is the correct treatment plan. Let me be super clear about this. For anyone experiencing symptoms, oral antiviral medications are the official first-line treatment for genital herpes. This isn't just an option, it's the cornerstone of how you effectively manage it. And the benefits here are huge. Unlike the creams, the evidence for oral antivirals is rock solid. They actually work. They reduce pain, they can significantly shorten the healing time of an outbreak, and they cut down on viral shedding, which is so important. They provide real, measurable benefits. So what are we talking about here? You've probably heard the names acyclovir, valacyclovir, and famciclovir. But here's the crucial part. These are prescription meds. You absolutely have to talk with a doctor or a clinician to get the right diagnosis and the correct prescription for you. Now, along with the medication, there are some really simple, effective things you can do at home to help manage the symptoms. Keeping the area clean with just some warm water, wearing loose, comfy clothing to avoid irritation, using some over-the-counter pain relievers if you need them, and of course, avoiding sexual contact until everything's healed up. It all helps. Now, there's one more little wrinkle we need to talk about. Sometimes those initial viral sores can actually lead to a totally separate secondary issue. And it's really important to know how to spot this if it happens. This complication is called a secondary bacterial infection, and it's pretty much exactly what it sounds like. Bacteria, usually common stuff like staph or strep, can get into those open sores and set up their own infection. And here's the kicker. This is a bacterial problem, not a viral one. So how can you tell if this is going on? Well, you got to look for signs that are different from the usual outbreak. Things like redness and warmth that's spreading, any kind of pus, pain that's actually getting worse instead of better, maybe a fever, or this very specific honey-colored crusting. Those are all red flags that something else is going on. And this is why that distinction matters so much. Your antiviral pills for herpes will do absolutely nothing to fight a bacterial infection. To treat this problem, a clinician might prescribe antibiotics. Sometimes it's a topical cream like mupirocin, or if it's more serious, it could be oral antibiotic pills. It's two separate problems that need two separate treatments. Phew, we have covered a lot of ground, right? From busting that common cream myth to spotting potential complications. So now let's just boil it all down into one simple, actionable summary for you. Okay, let's just run through this real quick. For the herpes virus itself, oral antivirals are strongly effective and absolutely recommended. That topical antiviral cream, minimal effect, officially discouraged. And antibiotics, they're effective, but only for that secondary bacterial infection, used on a case-by-case basis. So, after all that, what's the bottom line? It's actually really simple. When it comes to managing genital herpes, just forget about those ineffective topical creams. The proven, evidence-based, guideline-recommended solution is oral antiviral medication prescribed by a clinician. Following the science is the quickest and surest path to feeling better.